lot of our male patients get to us, they've already been to 5, 8 physicians, and they're still not getting the answer. They're still not getting better. The Flomax, which is for urinary retention and frequency, the overactive bladder meds, they're not helping. The UTIs that they think they're having, they're still coming back. It's the physicians that understand what pelvic health and pelvic floor physical therapy is. Then those physicians refer to us, or in some cases, the men find us on via Google. They're like at their wits' end.
Welcome to the Clinic Boss Show, everyone. Today we got Amy Stein, and she's a DPT owner of Beyond Basic Physical Therapy in New York. She got 2 locations with a team of 12, and they specialize in women's health, right? So, Amy, welcome to the show.
Thank you so much for having me. I'm excited to be here.
Yeah, we were just talking about it. We got some common like friends in the PT world, like Jessica Drummond. You know, she's the pelvic floor, business coach, and it sounds like she's kind of done some work with you as well, right?
Yeah.
So I'm so curious, how difficult is it to run like a practice in New York? You know, when I think about New York, I just think about it's expensive and it's competitive. Like you have to be really good at it, right?
Yeah, so I feel like I was fortunate in when I started my practice because I was one of few or almost zero. There were a couple of pelvic health PTs in the country that were doing pelvic PT, and I feel like it was a great time to start 21 years ago. I had already been seeing pelvic health patients for a couple of years, and then I started my practice in 2003, and I was one of the first to even just have a pelvic health practice. So I felt very lucky. Now, I have to say there's much more competition, and keeping up with it and keeping up with the practices that are the more I'm not sure if this is politically correct, but more of like the mill practices. They're
Sorry,
starting
the middle or the mill?
the mill, like they see like 3 to 4 patients an hour type thing.
Okay. Run of
So
the mill. Yes, I get it. Okay.
yeah. So what
Yeah.
I've seen in New York is that some of these practices that have really expanded in like the last 5, 8 years are implementing pelvic PT into
Okay.
the practice.
Okay.
But what's happening is that they don't have the time or the expertise to
Yeah.
really understand and treat pelvic pain.
Okay.
So I think some patients are getting help and it's fine. I would say the easier cases, the non-complex cases, but the complex cases, what I'm finding is they're either thinking that they failed the PT because it didn't work with the practices that are seeing patients like every 20 minutes, or they just don't think it's right for them. So, and then
Yeah.
a lot of those patients come to us still, and they're like, "Oh, this is what pelvic floor PT really is." So,
Interesting. I had Nicole on my show, like Cozy, and I think we both kind of know her.
yeah,
And she was talking about that, how we were talking about how a lot of these general orthopedic clinics, you know, call it run of the mill, um, they are introducing pelvic floor services within the clinic, right? But then the clinics aren't built or designed for pelvic floor because it's a very intimate experience. Like the ambiance is like different, like the music, even like how you onboard a patient is very different. And we were talking about that. So it's interesting to actually hear you kind of talk about that, right?
yeah, and so that's definitely been a challenge, I would say, in like the last 10 years that I've seen
Yeah.
like this shift. And I know a lot of them are taking insurance, so great for that. But
Yeah.
it is making it is making it harder for a clinic like mine that's out of network. We do one-on-one sessions for an
Yeah.
hour,
Yeah.
so it's just a different treatment plan.
Yeah. Yeah. And are your clinics like in downtown New York, or is it kind of on the outs? Okay.
Yeah.
So what has it been like in New York with like, maybe with like the op, like, because there's a lot of talks over the years about people not going back into work, or like rent prices going like crazy, like inflation. Like, are you seeing that within like the business environment in New York, running a clinic there?
Yes, definitely seeing it. Um, so one office is in Midtown, so a lot of like commercial. And I have to say the commercial, I mean, I have two family members that are in commercial real estate here in New York.
Yeah.
And they're saying how challenging it is in New York City to get the commercial, to get people occupying space again. So we definitely are feeling it. The other
Okay.
office is in downtown. So there's actually interestingly seeing like more residential coming from like a different borough, Brooklyn. So
Okay.
it's been an interesting shift. And it is, as you asked before, it is challenging. Rents are crazy in New York
Yeah.
City. And then
Yeah.
just the overhead in general, the even like the salaries and
Yeah.
just everything is it's definitely a bit more challenging in New York City.
Can you shock us? Like, how much per square foot are you paying in like your lease or real estate?
Um,
Like
I
per month or
I'm trying to think exact. I think it's like create like 1,000. I'm not exactly sure, but yeah, rent's like 20,000 a month here
wow.
in
That's
each.
how what's the square footage on that for 20,000?
So it's about, well, so what they do here is they include the hallway, they include the
Yeah.
lobby, they
Yeah.
include
Yeah.
the elevator. So I think
Yeah.
the actual square feet is about in each office is about 1,500.
Holy smokes.
Yeah,
That's crazy insane. You're paying $160 a square foot. That
right.
is insane. Like that is a lot of money.
Yes. Sorry, I couldn't do the math that quickly, but
No, no, but like you're saying it's 20,000 a month, it's 1,500 square feet. Yeah, like you don't count all the common space, right?
yeah.
And so you got to be good at your game to pay that type of like money, right? Let's be honest. Like you can't let too much things leak, it has to have a good patient experience, you got to be, you can't run this business on Medicare or certain types of insurance plans, right?
Exactly. Yep.
Wow. Wow.
Medicare in New York is not that supportive. So we actually, interestingly, what I've done over the last couple of years is I have a couple PTs that are taking Medicare. So like I'm not currently, I only see, 6 to 10 patients a week anyway, as a clinic
Yeah.
owner, manager of both offices.
Yeah.
But yeah, we've slowly had the PTs not take Medicare because
Yeah.
it's a break even for them walking in the door, even a loss. It
Yeah, I
to
was talking to this owner in Jersey, and he was talking about how much they get paid in Medicare there. It was disgusting. I'm like, why? How can you run a business where you're making $30 a session?
Yeah, yeah.
I was like, no,
I know
right?
it's sad though, because we want to help, but we're also like, but there is
Yeah,
a system with Medicare that if you don't
yeah,
take, they can opt out and they can sign
yeah.
a
But it
but
sounds like you're not doing that anyways. You're doing cash or out of network, right? Right? Which is like definitely the right way to go, right? So
yeah, especially for the specialty that we're in, like our patients need this time. They
yeah,
can't. I did orthopedics for
yeah,
3 years while I was congruent at the same time I was doing pelvic, and I was at one of those run of the mill. Is that what you're
yeah.
calling? I was
You
at
were calling that up. I would have called it cookie cutter physio, but that's different.
cookie cutter physio. Um, I was seeing 6 patients an hour sometimes. Six
You had an
patients.
assistant. Did you not have an assistant? You probably
I
had an assistant, right?
I think
Okay.
like 2 aides. And I was like, oh my, I'm not even, but I was right out of school. So it was
Yeah,
exciting for me. I was seeing knees and shoulders and Broadway dancers and
yeah,
theater
yeah.
and Wall Street people. So I was seeing the gamut. But yeah, six
Hey,
patients.
but Amy, I'm going to challenge you on that because, like think about a dental practice, right? And if you think about a dental practice is really good at working at teams, right? You got the hygienist doing certain stuff, like the ratio of hygienist to, assistant to the dentist, like they work in that team and total, like they're seeing six or they might be seeing like a lot of patients per hour, but like, the delegation of work, we're in this team day environment is I feel like our profession can do that to serve the amount of people. The question is like no one's had figured out to do it really well, right? And and the dentists have like they perfected it so that in a way is like the dentist like I'm not cleaning your teeth. That's why we got these hygienists to do that. I'm going to do the $200,000 work, not the not the $20 an hour work, right? So
Interesting. Yeah, good point. Yeah,
yeah,
I did feel like I was pretty good at delegating. So
yeah,
I liked it. Like I was able
yeah,
to do it. I got my Medicare patients in the corner, like practicing balance
yeah,
exercises with an aid, and then my
yeah,
show my frozen shoulder patient. I was like, all right, I gotta get in there.
yeah.
So
Yeah. Well, this is it's a philosophical debate, but like I know that most Americans or most people in this world don't even know what PT is, right? You know. And so, but imagine if people did know what it is.
right,
How could this profession even serve all these people? They
right,
can't because there's not enough therapists, right?
right.
And so if you can't work in this collaborative, like team-based model, like what the dentists have perfected, which is like been really good in terms of a patient experience, then this profession, once again, I'm getting philosophical here. I just seen it both ways, right?
Yeah, yeah.
Yeah.
So a lot of interesting when you say like a lot of people do know what physical therapy is. A lot of people still don't understand what pelvic floor physical therapy is. So when
Yes.
we're just told to just go to anyone, like pick someone
Yeah.
on a list,
Yeah.
yeah, it's a different experience because there's a huge range of training right now. With there needs to be
Yes.
more set guidelines on like what a pelvic floor physical therapist can and can't do. So.
Yeah. Cool. So what would you say is you've been in business for 20 years. What would you say are kind of the biggest like lessons you've learned with like running a business, growing like a team of 12, having two locations, running a clinic, like in probably the most expensive and hardest like city in the world, like New York. What would you say are the top lessons like you've learned in business over the years?
I've learned a lot. I have learned to really understand what your strengths are and really to rely on other people for what your weaknesses are. Because I mean, just simple things. And I think I was taught this like in the very beginning. Like you need a lawyer, you need an accountant, you need like a financial advisor, whatever the lists were, you need those. And I had those. So that was great. I have to say, probably for me personally, the management has been hard.
Yeah.
I'm really good with positive feedback. I'm really good with praising people and like I hate to say this, but I was a cheerleader, so I'm a good cheerleader. But when it comes to like difficult conversation
Oh,
and
yeah.
also recognizing like this isn't working out. I have someone in my office that's been with me for like 15 years. She's basically runs the office, and she's like telling me, she's like, this isn't working. You got to get on this. And I'm like,
Yeah.
okay.
Yeah.
So
Yeah. Yeah. Difficult conversations are hard. I think yeah, just, yeah, it is something that I see very common in the community, right? It's
yeah,
that,
another lesson learned with that, the difficult conversation is definitely something to work on, but also when there is something happening that's not positive in the work environment, like addressing it sooner rather than later and not skirting around the issue, like those are the things that I've really had to work on in the last couple of years.
yeah, I would agree. It's like your kids, right? If your kids are doing something wrong, do you wait like a week or a month or 2 months to talk about it? No, you deal with it right away, but you do it in a constructive way, right?
Yes.
Yeah.
Yep.
It's interesting. Like, I have a 9-year-old I was kind of sharing with you. And when I reflect back on like leadership and parenting, I feel like there's a lot of similarities, right? And if we could be leaders like parenting, where we are coaching our child, to be the best version of themselves, like that would be amazing. To be a coach, you have to push and pull. It's not just like praising, right? And what's interesting is that when I look at my journey of like leadership and management over the years. That when I started a business, I was like a dictator. I'm the boss. You do this, do that. I'm paying you. Like it was like this mindset I has like I'm paying people. They should be doing their work, right? And then and then usually we get a reality shock because we lose people, right? And then when I lost all these people, like really good people, then I went from a dictator to becoming a people pleaser. I
Yeah.
just want to like make you happy, right? Like rah rah cheer, like just stay, and then these people also left me because they weren't challenged and they weren't because we're not getting results, and the business wasn't winning. And when you don't win, and you got good people, like they leave, right? And so then, and over the years, I pivoted to this new journey where I'm embracing myself as a coach, right? So my job as a coach, I'm preparing you for the Olympics, right? In this role. And part of that is we got to train. I'm going to push you. I'm going to celebrate with you. But that is kind of that role that has evolved, like with my leadership, over the years, right?
Wow. I need to meet with you more. Because I'm like, oh my gosh, this is like my journey right here.
Yeah. No, but don't you agree? Like the dictator to the people pleaser, right? And then to becoming a coach, where like I don't want to tell you what to do, right?
Right.
And it's like our kids, like I don't want to tell my kid. I want my kid, like the best outcome with your kids is when they make the choice themselves, right?
Yep.
Like my wife is vegetarian, and so early on in my years, I had to like get my daughter to eat vegetables, right? And so part of that process is like, hey, let's go and do together. Let's go shopping. Like what vegetables should we buy for like thing? Like, but she has to be part of the process, part of the decision-making process, right? What are we gonna eat today? Option one, which is broccoli, or option two, which is kale. Pick one. I don't care which one you pick, just pick one.
Got
So,
it.
but
I do
yeah.
see the overlap with my kids too. And guess what? My weakness with my kids is also like I'm a people pleaser. And when they say when they're not, my kids are teenagers, so I'm
Yeah.
finding it even more challenging now because they're like, no, I don't want to do that. I'm like, oh.
Oh, geez, yeah, yeah. But like I said, I think we're both, like you're running a big team here, and like I think getting buy-in from your team is really important. You can't just enforce them to do something, and to do that, they have to be part of the decision-making process so that they feel like they were part of it, you know. And then you using communication and language to make them feel part of it, even if they fail, at least they own it and they care about it, right?
Yep.
Yeah. So I'm curious, like, if you think about this again, like if you're to like start your clinic from scratch, right? Like, what would you do differently know what you know now?
Oh, that's a good question. What would I do differently?
Yeah. Is
Um,
there a few things that you would point that you're like, I would do differently?
yeah, I mean, I do feel like I involved people right away, but I feel the same as you. Like, I don't know if I ever felt like I was like a dictator, like you were describing, but um, I do feel like I would have tried to involve people more in like maybe the management portion, or I think the higher decision making, that probably would have been, and I think also taking more like coaching and
Yeah.
how to have those difficult conversations. So I think those things for sure. I have recently thought about like I do have PTs that leave frequently because um, this is such a niche. So I've been trying to think about like how to get them involved without leaving, or if they do leave, like how do we expand our practice? Those have been things that I've been trying to, how do we expand the practice without like I already feel, as a two clinic owner, like I'm an owner of two clinics and a bit overwhelmed already, but what would that look like? So it is something I've started to like think about more, but
So
um,
creating a almost like a career roadmap for your PT so that they actually have like levels to go up, within the organization, right?
Yeah, that's hard too, though, because it's such a small, like, there's two offices, so there's
Yeah,
only five, six people in each office, so
yeah.
it's also challenging, but.
What's kind of your current org structure looking like right now? Like, what does your management team look like? What does it look like at the clinic level, maybe at the corporate level?
Yeah, so I have like a manager that helps with HR. Everyone, it's small practice, so everyone does wear different hats. And then the manager that I mentioned that's been with me for like 15 years, she actually always she talks about how she started with just filing way back when we had paper. Um, she started with filing, like, $14 an hour, and now she helps manage both offices, and
Yeah,
she, when I was mentioning, is really good with people skills. So that's something I wish I did have from the beginning. Someone at my, like, someone like her from day one that could help with the people skills, because I have a couple managers that I'm like, oh my gosh, how did I have them as a manager?
yeah,
And it was one of those things, like, people pleaser, so it took me a while to move on from realizing, like, this isn't working out, and 6 months later it's still not working out. Okay, maybe, and then they hit rock bottom, which that catching that sooner would have been a good idea, to move on sooner.
yeah. Wow. Wow. And would you still focus on a niche practice like pelvic floor, or you would go, like or you would do kind of the stuff we talked earlier, which is like a general orthopedic with like, like maybe a service of pelvic floor. Would you make any of those changes or no? Or are you happy with that choice you made with going all in on pelvic floor, right?
That's a great question. Yeah, if I could do it over, I probably would have tried to do more ortho first. But what happened, like a practice that was ortho first and then add the pelvic. But what happened with me was I was at one of the run of the mills, and or what did you call it before? The
Cookie cutter? All the cookie cutter clinics are get super upset with you, but like I'm not saying it's cookie cutter. It's just like like a general orthopedic clinic, right? Right? Yeah,
I that's where I started, and I started there. Started bringing in pelvic floor patients,
okay,
like they didn't have it at
okay,
all. And I went from 4 to 6 patients an hour to one every 45 minutes. And
yeah,
I had a book schedule with a wait list. So when I left, they all came with me. So all the patients came with me because they didn't have anywhere to go within that company. So I didn't start with orthopedics because I started with pelvic because it landed in my lap,
yeah.
which I'm very lucky for. But yeah. And
So
it's
if you reflect back, would you like, is that what I'm hearing? Like you would do a general orthopedic and like add the niche service, or you would keep the niche?
so I love the niche, but I do feel like from a business perspective, having the ortho more prominent in the practice would be more helpful and
Yeah.
helpful now. Now that
Yeah.
there's more pelvic floor competition, yes,
Okay.
there's more known about pelvic health today more than ever. It's still fairly unknown, but it's better. And now that there's so much more competition, I am like, oh, if we had some, just some ortho, it would help balance. It would help balance.
This
And
is interesting. And here's the thing. I'll just be honest with you, Amy. Like I got the luxury of seeing hundreds of like P&L statements, right? Profit and loss statements of like clinics and chains and I'm not single out public floor, but I find that most of the niche practices that I see, the revenue and the profits are like it's somewhat limited on how big you get. It works if like you want to be like a solopreneur with a couple of practices, but back to what you said, like when I think about, does it make sense from a business standpoint where you don't treat and you run it like a business? Like my favorite clinics when I look at it are the ones that have they're doing like, 2, 3, $4 million of revenue a year, and like they got, I would say diversified like revenue streams, where they do have like, yeah, like they might do a half a million of like, like pelvic floor, they're doing the half a million of like maybe like peds, right, maybe another half of like OT or something else, right? And the other stuff is like, um, a million of physio, right? General orthopedic, another million of like chiro, right?
Right.
And then, and then even another like, I would say another million of cash-based like LMTs, like massage therapy, right?
Well, maybe I should start doing that.
Well, I'm not saying you do that, but that's a different level of complexity. But I'm just telling you, like, those are the type of practice that I've seen. Like, I'm like, oh man, those are really good looking P&Ls when I look at it. I was like, and it makes enough money where it pays for like really good talent, in your management teams, right? So, um, but yeah, that's interesting you brought that up, and so I've always wondered that because on whether people who double down on niche, whether they would do it differently, so but like you said, competition is getting more and more like fierce, not just in New York, it's everywhere is like this, right? Right? Like I see a lot of, like solopreneurs or a lot of, cash-paced therapists, like they just want to go up and open your clinic, have one or two, three therapists, and they're happy, right? But that's not really running a business, right? Because, like with two, three therapists, it just kind of is like a break-even operation, right? We agree.
Yep.
So it's hard to be like, and you could be more fulfilled if you like, there's nothing wrong with doing that, but just know that like, if your break even point is having two or three therapists working there, then it's more of like a lifestyle business, right? Versus, because you could choose, I don't want to have a lot of staff. I could choose my own schedule. I could do whatever. Like that is okay. There's nothing wrong with that. But from a business standpoint, from a return on investment, is very different. You got to look at it differently, right? So
Yep.
yeah. Would you agree or no?
Oh yeah. Yeah, I agree. I
Yeah.
also feel like it's more stable too. I would say in the beginning it was pretty stable because it was just me. I had a smaller office. It was in Times Square actually.
Wow.
But
That's
I know
insane.
people are like, wow, the rent must have been so crazy. But when I was there, it was when Times Square was transforming and they
Yeah.
won a commercial in there. So they gave me a decent deal for New York City.
Yeah.
I
Yeah.
think then it
Wow.
was like to give you an example, it was like 30 a square foot, 35
Okay.
compared to
Yeah.
now.
Yeah.
So,
But that was 30 back like years ago, right? When the value of the dollar was probably like worth like, way more, right? So
right, 21 years ago.
yeah.
So and
Wow.
now Times Square is like triple and
Yeah. So I'm checking on your social media account. Like you guys are rocking it, Like who does it? Who does your social media account within the business? Is it you? You pay someone or someone on your team? Like who's doing it? You guys are rocking it, right?
yeah, we do have a strong like marketing team because I personally try to get more like into the business end while still seeing a couple patients, blah blah
Yeah.
blah. I actually love the marketing part, but in the last couple of years, and since I opened the second practice, which was just about 5 years ago, I did realize like I have to delegate more.
Yeah.
So, in the beginning, it was just more me and
Okay.
the PTs. Now I have someone that helps with our social media, an outside source.
Okay. So an agency, or like, is it part of like some social media coordinator like that helps you with that, or is it an agency?
I would say it's like it's their own small business, and they do
Okay.
this like
Okay.
we do. And then
Okay.
we give content. So I have a
Okay.
marketing manager here.
Okay.
Um, that she works for Beyond Basics Physical Therapy. And then
Okay.
she helps to organize our social media. She helps to organize our website and our SEO and SEM. And
Okay.
then she obviously also helps to organize when we do the reels and,
Okay.
whatever. So I remember I started with Facebook, and even then
Or MySpace, MySpace.
Oh no, MySpace. MySpace.
I was on MySpace.
And I have to say, I've had like my own, like, I'm into it, I'm not. I have to say, I've
Yeah,
taken like almost like a 3 year, 2 year, 3 year hiatus of.
good for you. Good for you. Yeah, yeah. So,
I'm
so, so what I'm hearing is that you've outsourced your social media content, to like to another company or another agency, like they're a small business, right? And then they send each week to you like, hey, like this is what we need from you, this is what's trending, and then you guys go back and send them like the videos or like the information they needs, so that they could cut it up, make you look like rock stars, right?
exactly.
Okay,
There are,
amazing.
yeah, and then the PTs, like who wants to do it, who's interested. So
Yeah,
that's one thing that I definitely try to get them involved. Or do you want to write a blog,
yeah,
or do you do a talk? We do quite a bit of talks.
yeah.
Um,
And do you
so
pay them to do it, or like they just do it because of like they're part of the team and it's a clinic culture thing?
so the blogs are a lot. So we actually about a year ago started paying for the blog because we were like, this is a lot, and it takes a long time.
Yeah,
But the social media part, like the videos and stuff, we try to do it during their hours so that one we have to be careful about burnout too, right?
yeah,
So
100%. Yeah,
we try to do that during their hours. Right now, like for the last so I opened downtown 5 years ago. Here it's about 6 years ago. Here's 21 years. We've always had more people in our midtown office than our new office. Right now
mm,
it's reverse because I did lose a PT, actually two PTs. So then it becomes like a time issue. They just don't have time. So
yeah,
that when I pay extra to do like an hour of social media, but
yeah, yeah. But do you find that like the person, it sounds like your manager there, like, when she gets them to do like silly stuff, like on social media, like it actually strengthens the clinic culture and it brings everyone, and like everyone has like a giggle. So using the social media, like to create the content also helps with your clinic culture, right? Is that something that you see within your practice or not?
yeah, that's interesting. I hadn't put that together, but yeah, because we've had some silly ones and everyone's like, oh my gosh, did you see that? Did you
Well,
see
yeah,
it?
like I think it's these subtle things that happen because like when you get them to like do jumping jacks or do something silly and it's like awkward for them, they don't want to do it, and then like have the biggest kick with like filming it, like it's like amazing for culture, right?
Yeah.
Yeah. I even seen this one clinic that they would decorate a special phone, it would have diamonds all over it. And the whole purpose of it was that like, hey, they would use this to document like live stuff when it happens. And people like would like, they would love it, and every time they do it, like it just brings the team together because everyone's just like laughing and joking around and stuff, right? So
Yeah. I like
yeah.
that tap. You can use that as like team building.
It is team building, right? Well, it is, right? You think about it, like, because, like, the stuff you get from your social media agency, like they tell you to do something like really like do this trending reel and you gotta look like an idiot, right? And it's very unprofessional. But, and actually that's the second question, because when I look at your social media account, it's very different from most typical clinics that I see, right? Like, most clinics typical I see is like there's a very professional medical tone that has no engagement, right? Versus when I look at yours, it's like entertaining, it's like fun, maybe you could talk about that. Is that kind of was that kind of part of your strategy? Like,
Yeah, I have to say again, I'm not as savvy about social media. So I do depend quite a bit on we use a company called Nailed It.
yeah,
And so I depend on them. And then my marketing manager, she's really helpful with that. And she even is like, okay, we need to make this fun. It's also the topic that we treat. So we treat bladder, bowel, sexual dysfunction, and we
yeah,
see um, we see all genders, and we actually see peds too.
Yeah.
So really, so also making the material lighter. It's hard. It's hard when you're talking about sexual pain, or leaking after pregnancy, or leaking during workout routines at the gym, and in classes. It's a topic that's, it's like so taboo that we want to make it untaboo.
Yeah. Yeah.
That's more
But it's working because you got amazing engagement, like, and you got the followers, and like I just look at it, I'm like, oh my, because I had this debate all the time with a lot of clinics in our community, and a lot of them were like, no, I'm not doing that. Is like it has to be professional medical, right? But it's not working.
I know.
Like people don't go to social media to get, like, people go there to get educated, and it has to be like fun and light, right?
Yeah, yeah, yeah.
Yeah,
So
yeah,
my marketing person's like, Amy,
yeah.
you need to get back on social media. And then we joke, because she's like, so you're the OG of, which I didn't even know what OG meant. She's like, you're the OG of pelvic health. You need to get on as the OG of pelvic health. I'm like, okay, I'm
Yeah.
gonna try to get back
Yeah.
into it.
Yeah. That'll be your new handle. It'll be OG Amy, right? And I'm curious, does your social media channel, does your social media actually helps you with getting new patients? Like, do you see that or not really? Right?
So that's interesting. And that is one area that I am more interested in. I mentioned earlier, like some of the management part, not my strength, but this part I like. And interestingly, over the years, even when there was no social media, now that there's social media and internet, there wasn't internet, that much internet when I even started. It's still the providers that are our number
Okay.
one referral source. The
So
providers.
then no, like you don't feel like you're getting an ROI on social media, or you don't know.
I think we get some. I think we get
Okay.
some. And I think what happens is that some people get to know a PT,
Yeah.
because you can see with our social media that we try to get all the PTs involved.
Yeah.
Those, but they get to know the PT, and then they actually ask for the PT.
Okay.
But I would say our top is still the providers. And
Okay.
then
What do you mean
what
by providers? Like you're talking about like doctors or like business in the community? Like what do you mean by providers?
providers, like the doctors. So
Okay.
there's our number one referral source.
Eh,
Doctors, we also see, we get patients from like acupuncturists and
Okay.
sexual health
Yeah.
practitioners. So
And who does that? Your marketing manager does that? She goes out and does all the relationships with the docs or the other healthcare providers in the community. Is that kind of her role then?
yeah, that's part of her role too. I have to
Yeah.
say, in the beginning, I loved doing that. So I
Yeah.
like, I opened my practice, I was, again, I felt very fortunate. I had like 60 patients on my schedule. So I was seeing,
Wow.
and it was like every 45 minutes to an hour. So you can imagine how many hours I was working.
That's insane. That's
I
insane.
still like that marketing part, because I also wanted to get the word out about how we can help these patients. So I would, in my downtime, I would just, as they say, pound the pavement. I went
Yeah.
and tons of
Yeah.
doctors in the
Yeah.
beginning.
Wow. Jeez.
I
So
do it.
doctor marketing still works for pelvic floor clients, eh? Jeez. That's that's not what the other business coaches are telling. Like all you have to do is spend money on Google.
Oh, that's
Yeah.
interesting.
Is Google working for you? Like are you converting on SEO or SEM, like when people search for a pelvic floor physiotherapist, is that a good channel for you? Like on ads, Google ads and
Yeah, so that's our second. So
okay,
it's doctors and healthcare providers, and then
okay.
Google, SEM, SEO, and website. Yeah.
What and is like is there certain keywords that seem to work really well for you, or is it just the same ones like pelvic floor, or is it more the condition, like I'm leaking my, I'm peeing my like I don't I'm gonna be butchering on peeing my pants. I don't know if that is like a
Yeah,
keyword. Have you find something that works really well for like, or is it like I want a pelvic floor physiotherapist in New York?
pelvic floor physical therapist. Yeah. Um,
Okay.
we're like experimenting with the words and things.
Okay.
Um, so yeah, I have to say too, for anyone that's out there, I did also write two books, and I
Okay.
do feel like that helps as well. It also helps for the uh, just patients kind of they
Yeah.
appreciate respect. Basically, they're like, "Wow, you wrote two
What's the
books."
name of the book that you wrote that is the bestseller?
I have them here, but oh, you can't see it because of the background.
What is it?
Yeah, I wrote
Heal pelvic pain, right? Is that what it says? Okay.
I did that, and
And so
in
what happened? So what happens like when a patient comes on? Like, do you give them that book? Like, is that part of your like onboarding of a new patient?
yeah, for some already have it. So some have found
Okay.
this through my book. So the other book is also Beating
Okay.
Endometriosis.
Okay.
Newer.
Okay.
It does help. It's an added. Is it
But
like
how do people get your book? How do people know about this book? Is it because you're doing talks, or are you doing like certain types of workshops and then you give them the book? Like how is this book being like promoted across like what you do?
right? So I have to say that social media did help with that because
Okay.
my sales have gone down since I am not on social media. Because when I was on social media, I would say I'm the author of Heal Pelvic Pain and Beating Endo.
Okay.
Uh, now that I am not on social media as much, I have to say book sales have gone down.
Okay. Okay.
um, that so yeah, so I would do giveaways on social
Okay.
media. Giveaways, but I would personally do giveaways.
Yeah.
I would take them to conferences. I would
Yeah.
reach out to certain societies and be like, "Hey, if you want to do like a book giveaway, happy to donate a book."
Yeah.
In this, if so a lot of the patients already have the book, so they've
Okay.
searched it on Amazon or their
Okay.
physicians. When I told you I was pounding the pavement, I
Yeah.
literally when the book came out. It was like my
I
second.
love that. I
I
love that. So it's like, here's a referral form. By the way, here's my book. I'm a famous author for this specific topic. I am an expert, right?
yeah.
I
So
love that.
now, yeah, now I don't pound the pavement as much. We do more
Yeah.
snail. And obviously there's a time and a place for that too. But
Yeah.
uh, what I do is I try to send the book with like if we have a new provider, I send the book with it. So then the letter and the material doesn't go right into the trash. So like, oh, there's a book here.
Yeah. 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 No, I love it. And the book is what, like $4, right? Like is that the price? Yeah.
Yeah, one book is right now it's its lowest it's ever been, $9. The Heal
Yeah.
Pelvic Pain on
Is that
Amazon.
your cost or is that the price of the book? What you're selling it for?
On Amazon. Yeah.
Okay. Yeah.
And then the
So
other book,
what do you think the cost is to make like your cost to sell to create that book?
oh, that's a good question. Because I don't do that part.
Okay.
I had two different publishers help with the
Okay.
book. I'm
Yeah.
sure
Because
it's not a lot of money, but I get the royalties from the book. They own the
okay.
book. So McGraw-Hill and HarperCollins, they
Interesting.
and I get the royalties. We still have not gotten the what they'll do is they will a lot of the publishers will give you an advance
Yeah.
towards writing the book. And so for Heal Pelvic Pain, it was only like $7,000, $8,000. So I made that back I made that quickly.
Yeah.
Raw Hill obviously took that money, and then within 2 years, I was making royalties. Granted, it's like $1,000, $2,000 a year. In the
Yeah.
beginning, it was more. In the beginning, it
Yeah.
was more. But the
I just think it's a brilliant I think it's a brilliant approach when you do doctor and call it like provider marketing, right? Where like you got your manager, you got marketing going out there, and they're like, hey, by the way, like, hey, here's this book, and this book, like, if it costs you $2-3 to make, like, whatever, like, that's cheaper than making a freaking postcard, and it's more impactful, and then your authority just goes up now, right?
yeah, exactly.
Yeah. Yeah,
So
it's
that's
genius.
that that I try to use to like differentiate us from other practices too. Like we've written books,
Yeah,
uh,
yeah.
and
Wow,
21
that's
years.
amazing. So you talked about healthcare providers. What are the top like pelvic floor referral health providers? You mentioned acupuncture. Was there anything else that seems to like work well for you guys?
Acupuncture is a small provider list,
Okay.
but just because also like not a lot of acupuncturists specialize in pelvic health, so they
Yeah.
wouldn't some don't even know to refer probably still.
Yeah.
The interesting thing about pelvic health is from the physician perspective, we do get some from primary care and even orthopedics because you
Okay.
has a tailbone, they have a sacrum, and they have a pelvis. So there's
Yeah.
definitely an orthopedic angle to it. Plus hip, there's a lot of new finding. Well, not they're not new anymore, but there's a lot of findings that hip dysfunction contributes to pelvic pain, pelvic health issues. So we
Yeah.
get, but we also get the GYNs, which probably more people are like, oh yeah, that makes sense.
Yeah.
Um, but we get referrals from urologists, um, GI,
Wow.
yeah, GI
Okay.
doctors. We see a lot of bowel issues. So actually, the subtitle of my Heal Pelvic Pain book is Proven Stretching, Strengthening Nutrition Program for Pain, Incontinence, IBS, and other symptoms. So we do see quite a bit of like IBS, which is more a general term for just bowel
Yeah.
issues. And then colorectal too. We get some docs from
Okay.
colorectal, like rectal pain and
Okay. So most of the providers are within still like the medical community, not like the allied health, right?
most within the medical. But then we still have like physical therapists that, like ortho, that are like,
Okay.
oh, I don't do pelvic.
Yeah.
I gotta refer you somewhere. So
Yeah. Yeah. And do you guys actively market that or not really?
we do, but I have to say
Okay.
we haven't in a while. So
Should throw that book in there, you know?
no, throw the book
Right? You know? I love that. And I'm curious about this topic because actually someone in our community asked about this. Um, is there a market for pelvic floor for men?
Oh yeah, of course. Yeah.
Yeah. Do you see it as equally as big as the women, or is it like, like from, or is it a small, like much smaller percentage?
It's not much smaller for sure. I'd say the biggest difference is that for women, they do have, not all obviously, but some have the childbirth.
Okay.
Um, so that contributes to the patients with female anatomy. There the issues that could arise with that, and then also menopause for women. So those both can contribute to pelvic health issues. But all the other ones, like the urinary urgency frequency, the bowel urgency frequency, retention, so causing
Yeah.
constipation, those are all that's I would say that's almost equal between.
Wow. So your practice, like, is it 50-50 people coming in, or is it 90% like women still, right?
No, it's like 65%.
Really?
Yeah.
Wow. I'm actually fascinated by this. And once again, I don't know. Like this is I'll probably need to come to your clinic in 5 years. But like do
Or,
the do,
or just
and
get
and,
or just
and do
get
them
my book
uh,
explained.
all right. I'll get
But
the book and I'll do my Kegels, right?
you're welcome though.
Um, are they okay with like, do men want to see like a men therapist, or like do they typically prefer like they're okay with seeing a female? Because this is a very sensitive issue for like for all people, but like I think especially with like men like me who have like maybe high ego and they can't talk about these difficult conversations.
Yeah, it's definitely a challenge, but what we find, and it's a great question, what we find is unfortunately, by the time a lot of our male patients get to us, they've already been to like 5, 8 physicians, and they're still not getting the answer. They're still not getting better. The Flomax, which is for urinary retention and frequency, the overactive bladder meds, they're not helping. The UTIs that they think they're having, they're still coming back. So
Mm,
that's when and again, it's the physicians that understand what pelvic health and pelvic floor physical therapy is. Then those physicians refer to us, or in some cases the men find us on via Google. They're like at their wits end, and
Oh
so they
yeah.
see us, they're like,
Wow.
we probably, I would say probably one in probably 100 ask for a male therapist, but most prefer female.
Yeah.
There are some religions that they actually prefer male.
Interesting. Interesting. You're right. I can see that.
Yeah,
It's
but
like I have a therapist I prefer to talk to like a female just because I could, I feel more comfortable. I don't know if it's like the male versus male thing, but I personally just I'm like, why is it that my preference is talking to a female therapist, So
yeah, but
yeah,
we've been doing this so long that it's like we make them feel comfortable. If they don't
yeah.
feel, we work around certain things, but
Wow, this is fascinating. This is way higher than I thought, 40%, eh?
and we
And
see
like,
pediatrics.
yeah. But what I'm hearing is that like the key to this still seems like it's the doctors, right? Right? The doctors and maybe Google for pelvic floor for men, right? Is that what I'm hearing? Do you get a lot of word of mouth from men or no? Or do they share with like because I can't see like me like if I just think about some of the health issues I have like maybe I don't think I share that with everyone. I might share with like the ones really close, like one out of like 10 people. Like it's not like, hey guys, like like
Yeah, I would say the referrals from other patients is more when it's like a family member.
okay,
Female, we find it's like friends. Like the
okay,
female population, we find like, oh, I'm friends of so and so. The male population is like, oh, my wife sent me here, or my niece or nephew or whoever told me that they came here and they had great results, and they suggested I try this because I'm peeing every 10-15 minutes. Um,
you
or
know
I,
what? Yeah. And what you're saying is I could totally relate. I'm just thinking like, so what you're saying is like word of mouth for females typically are like friends and family. Like they just want to share with everyone if it works, right? Right?
oh
Whereas
yeah,
for
not all though, not all, but
okay,
more. I would say more.
more. Whereas males typically, if you're getting word of mouth, is usually from a family member, right?
Yeah.
That's an interesting distinction. That's cool that you could see that, That's very, how do I say this? It's interesting from a psychology like and behavior standpoint, right? Why you wouldn't do it, why wouldn't it be the same, so
And if you see also, I just thought of this. There are a couple documentaries now on like endometriosis. So that is more female anatomy condition.
yeah,
Um, they talk more openly about it on these documentaries. I'm trying to think of, yeah, I guess there are a lot of other documentaries that would like talk about
yeah,
like patents and stuff, but
yeah.
uh,
So
so.
so when it comes to your marketing, do you do a lot of marketing focus on like the males or like is it balanced or is it mostly females then?
I would say it's pretty balanced. So the
Okay,
neurologists, they see some neurologists see primarily female, some do see primarily male,
yeah,
but we try to talk to both groups.
okay,
Rectal doctors, they obviously
okay,
see both, so they would
okay,
refer both genders. So
okay.
yeah.
Wow, maybe you could do a photo of me like in my pants and I have wet pants on, right? I see a lot of those like images like on a lot of Instagram, like they're trying to, but I usually see females, but I never see the males. I'm like, oh my gosh, like I feel like you could, really open something up if you could crack this, right?
Yeah, and I feel like when I think about the how long it takes the female and the male to get to us, I'm like, oh, I feel like it's a disservice for them because I'm like, so when you have, whenever I do a talk, I try to use this analogy. When you go in for shoulder surgery, when you go in for knee surgery, the one thing they say a lot of times prehab, like before the surgery, but also post-op, they say you need to start PT, you need to start scar tissue mobilization, you need to start range of motion. It's the same for the abdominal pelvic region. No matter what surgery, what gender, like you need
Yeah.
to start the PT right away. And
Yeah.
even for like a condition like endometriosis, they were even saying, I just spoke at a conference recently for that, and they were saying like, oh, you got to wait the 6 to 8 weeks. Now they're saying no, because
Yeah.
you need to start that mobilization to make
Yeah.
sure that scarring doesn't start to adhese.
Yeah. Wow. I
So
love it.
similar to shoulder, like you don't want to wait. You know what happens as an ortho PT. You know that
Yeah.
if you wait too long, that shoulder is going to be frozen and not want to move. So you got to get in there right away. So now they're
Wow.
saying, it used to, when I started, it was like 6 to 8 weeks. You need to get the doctor's approval. Now they're saying like pretty much right away, you got to go for PT. And then, so for some male, the prostatectomy surgery, like
Yeah.
we should be seeing them before. So they have good behavioral habits prior,
Yeah. Yeah.
uh,
Yeah.
and then after. So just an
Wow.
example. Yeah.
This is so cool, man. I really enjoyed our chat today. And Amy, I'm curious, how do people find out more about you? You know, and where can they buy your book?
So the book, Heel Pelvic Painting, Beating Endo, they're both on Amazon. Barnes and Noble still? I don't even know. I'm
Yeah.
dating myself.
Yeah.
It used to be
It depends on the cities. Some of them are bankrupt, some of them are not, right?
so primarily Amazon.
Okay.
On our website, Beyond Basics Physical Therapy, we also have links to it. And
Okay.
then social media at Beyond Basics PT, we're pretty active. We do a lot of educational stuff. So we do free like in services too. We have a pelvic health 101 that we do yearly. And
Yeah.
that's
Love it.
just community outreach, just telling everyone like this is what pelvic health is. It's actually coming up in a month. So
Yeah.
so
Wow. Sounds good. Amy, the OG. Thanks for coming to the show, Amy. This is like amazing. I'm glad we finally connected, right? So
yeah, thank you so much for having me. And I appreciate you doing this talk because getting the word out about pelvic health is for everyone is really important.
yeah, love it. Cool.